Good evening. My name is Kimberly Jenkins, and today I will be presenting a strategic plan to improve the transition of care communication among caregivers in the emergency department and inpatient nursing units here at our medical facility. As healthcare providers, we know that transfers from the emergency department often result in a series of handoffs among nurses and physicians. Recently, we've found that there's been an increase in medication errors, delay in diagnosis, adverse events, on discharge follow-up phone calls. Patients and caregivers have voiced multiple complaints. And as a result, we've created a strategic plan that will help us alleviate some of these issues. Our goal is to ensure that all patients receive safe, effective, timely care during their transition from the emergency department to our inpatient units. And we hope that this will result in a reduction in costly hospitalizations and improve our patients' experience here at our facility. To begin our strategic plan, we identified our strategic goal. And the goal that we've identified is we want to improve the effectiveness of communication among caregivers in the emergency department and inpatient units during transition of care. To begin our plan, we initiated a SWOT analysis. During the SWOT analysis, we identified some of our strengths, weaknesses, areas of opportunity, and threats. And as you can see, we had multiple strengths. In fact, our strengths outweighed our weaknesses. After the SWOT analysis, we conducted a stakeholder analysis. Within the stakeholder analysis, we identified those stakeholders that we wanted to keep satisfied, those that would be monitored or managed closely, those that we would just monitor, and then those that we would keep informed. After conducting the stakeholder analysis, we then created a strategy map. Our strategy map allowed us to identify some of our key drivers here within the organization: learning and growth, internal business processes, our customer, the patient, and finance. Upon creating the strategy map, we wanted to promote a standardized communication tool to foster continuity of care. In order to do this, we found out that we would need to collaborate. Collaboration would be with multiple disciplinaries, but more importantly, we would collaborate with our IT department to develop a transition support tool. Upon developing this tool, we would integrate it into our medical record system, and this would assist with timely diagnosis and in turn decrease costs associated with poor communication. Also, as a part of learning and growth, we could enhance communication training for the emergency department staff nurses and increase the emergency department's staffing matrix. As a part of the internal business processes, that would then lead to our education facilitators incorporating the handoff communication into staff orientation or new staff orientation. We can also collaborate with HR to assess compensation for nurses. This would serve as an incentive to get nurses to come on board and also to improve compliance. Um, as a result, we will impact the customer by increasing our patient satisfaction rates. With increased patient satisfaction rates, we get more patients coming in, and this will increase our Medicare and Medicaid reimbursement. So as you can see, it all works together to ultimately achieve the goal, which is to improve the effectiveness of communication among caregivers in the emergency department and inpatient units during transition of care. After we've created the strategy map, we can move on to creating an action plan. The action plan that we've developed would actually be in the form of a policy or policy recommendation. First, we're going to create a standardized tool, as stated earlier, to incorporate into our electronic patient record system that we already have in place. The standardized form will be used for all transition of care from the emergency department to the nursing units. And that form will include the patient's primary diagnosis, the problem list, medication list, the referring physician, contact information, vital signs, medications that were given in the emergency department, the patient's mental status during the time of transfer, any test results or tests that were performed in the emergency department, the patient's code status, advance directives, consents, and the name and contact information for the clinician giving and receiving report. Our action steps will be determined by the multidisciplinary policy team that will be put in place. This team will suggest a final standard information set, and the information will be disseminated to all stakeholders, including nursing, and unit teams will test the forms or use as a pilot on identified units to start with, and we will monitor implementation from there of the new policy and communication tool. Some managerial strategies that will be used when implementing this action plan will be a pros and cons analysis. With the pros and cons analysis, we will be able to use in areas where effects must be understood and decisions must be measured objectively. We will also utilize group decision making. With group decision making, we will be able to promote collaboration by evoking an open exchange of dialogue, of opinions, ideas, skills, and knowledge from members of the group. Our hopes is that decisions will be reached at a higher level of agreement and compromise, which will in turn increase the possibility of implementation. We will also implement various leadership strategies beginning with coaching and feedback. Designated leaders on each nursing unit will coach staff members on effective communication and coach them on proper utilization of our standardized tool. And leaders will also allow for staff feedback. We're going to use various team building exercises, and we're also going to use this as an opportunity for staff development and performance management. Okay. How are we going to communicate our plan? Well, we're going to use multiple dissemination strategies. We're going to utilize emails, staff in-services, education rollout sessions, mock exercises. With the mock exercises, this will be an opportunity to highlight where communication breakdown occurs. It'll also give staff members an opportunity to engage and interact so that we can get a real life or live presentation of what actually happens during communication or transfer communication processes. We're also going to utilize narratives or patient stories. At this time, staff members will get an opportunity to tell their patient stories, highlight both the negative and positive interactions or communication breakdown stories. We're going to utilize the organizational newsletter. And we're also going to utilize the grapevine. Okay, traditionally the grapevine is viewed as a negative, but here we're going to use it to our advantage. The grapevine will allow managers to turn gossip into a means of honing in on situations that need immediate attention, such as resistance. We're also going to utilize conference calls for those stakeholders that aren't able to attend meetings and other on-campus and services. How are we going to evaluate our plan? Well, we're going to utilize the Hospital Consumer Assessment of Health Providers and Systems Survey, better known as the HCAHPS, which is a survey that's usually performed after the patient's been discharged. And we can utilize the information as a way to identify opportunities for improvement. We'll also monitor compliance with standardized forms via an audit tool that will be created by the policy team. We will use statistics from the tool to guide us into the right direction or show us areas that we need to improve upon. And we will also use observation of procedure, which we will have members of the leadership team on the units observe staff members, nurses, give handoff communication during the time of transfer. And at that time, staff members will be audited. That is the end of my presentation. I welcome your questions, feedbacks. This is your time to voice your opinions. If there aren't any questions, then I would like to thank you for your time and have a good day.